Sting investigations. Advanced security training exam prep. A person who has completed the basic security training course in BC is authorized to use handcuffs. A. True. B. False. B. False. How many times does a person have to take the AST exam before they must redo the course? A. 1. B. 2. C. 3. D. As many times as it takes to pass. C. 3. Metal chain link handcuffs are the only type of restraining device that a certified security guard can use. A. True. B. False. A. True. Individuals that have AST certification must recertify every A. 6 months. B. 2 years. C. 3 years. D. 5 years. C. 3 years. Use of force reports are used when A. Handcuffs are used. B. Someone gets injured. C. Someone gets arrested. D. Force is used. E. All of the above. E. All of the above. The Code of Conduct for Security Guards states the following. A. Act with honesty and integrity. B. Comply with all federal, provincial, and municipal laws. C. Shall not use excessive force. D. All of the above. D. All of the above. Upon completion of the AST exam, individuals must submit an application to security programs to reissue their security worker license with AST certification. A. True. B. False. B. False. The National Use of Force Model describes the following. A. Risk assessment. B. Subject behaviors. C. Describes a range of force response options. D. All of the above. D. All of the above. What is most important part of the National Use of Force Model? A. Subject behavior. B. Response options. C. Assess, plan and act. D. Act, plan, and assess. E. None of the above. C. Assess, plan and act. The continuous assessment process is a 4-step process. These steps must be taken in which order? A. Reassess, assess, plan, act. B. Assess, act, plan, reassess. C. Act, plan, assess, reassess. D. Assess, plan, act, reassess. D. Assess, plan, act, reassess. Which of the following are considered influencing factors in the assessment process? A. Your ability, size, and strength. B. Subject. C. Environment. D. All of the above. E. None of the above. D. All of the above. Which of the following are considered indicators of potential problems? A. Subject ignores security guard. B. Subject clenches his/her fists. C. Subject looks around and ignores security guard. D. All of the above. E. None of the above. D. All of the above. Reactionary gap. Reactionary gap, the distance between the security guard and the subject. Increasing this can give more time to consider other options. The security guard's primary consideration must be to ensure the safety of him or herself and then the safety of the public. A. True. B. False. A. True. A cooperative subject is a yes person. A. True. B. False. A. True. A subject that goes limp like deadweight can be best described as A. Cooperative. B. Passively resistant. C. Actively resistant. D. Assaultive. E. Deadly. B. Passively resistant. A subject who lunges towards you, throws punches and tries to physically assault you can be best described as A. Cooperative. B. Passively resistant. C. Actively resistant. D. Assaultive. E. Deadly. D. Assaultive. Which of the following force response options are appropriate for security guards in BC? A. Presence. B. Communication. C. Physical force. D. Intermediate weapons. E. All of the above. F. A. B. C. F. A. B. C. The communication response option involves the following: A. Verbal and nonverbal skills. B. Voice and tone. C. Words only. D. Presence. A. Verbal and nonverbal skills. Which of the following physical control examples are appropriate for security guards? A. Wrist lock. B. Knee stun. C. Escort lock. D. Palm thrust. E. All of the above. E. All of the above. The palm strike, straight punch combination is an appropriate response for a security guard against an assaultive subject? A. True. B. False. A. True. Presence and communication can be effective for dealing with a passively resistant subject? A. True. B. False. A. True. The primary goal of tactical communication is to gain voluntary compliance from the subject? A. True. B. False. A. True. Physical control may be considered by the security guard when communication and presence are not effective. A. True. B. False. A. True. Which of the following are examples of physical control? A. Escort lock. B. Palm thrust. C. Balance displacement techniques. D. All of the above. E. None of the above. D. All of the above. A safe interview stance is a balanced and protected position from which the security guard can respond quickly. A. True. B. False. A. True. Standing too close to the subject can result in the following: A. Less distance to react. B. Impairment of peripheral vision. C. Possible loss of balance. D. All of the above. E. None of the above. D. All of the above. Relative body position 1.5 is also referred to as A. Interview position. B. Safe interview stance. C. Escort position. D. Behind the subject. E. Directly in front. A. Interview position. Relative body position 2.5 is also referred to as A. Interview position. B. Safe interview stance. C. Escort position. D. Behind the subject. E. Directly in front. C. Escort position. Relative body position 1 is also referred to as A. Interview position. B. Safe interview stance. C. Escort position. D. Behind the subject. E. Directly in front. E. Directly in front. Relative body position 1 is the safest position for the security guard. A. True. B. False. B. False. Stepping out of the line of attack and blocking are both evasion techniques. A. True. B. False. B. False. Which of the following are not sound disengagement strategies and tactics? A. Proper relative positioning. B. Correct body positioning. C. Active resistor. D. Visual scanning. E, B, and D. F, A, and C. E, B, and D. Pain-sensitive areas can be used to control passive and active resistors. A. True. B. False. A. True. Pain-sensitive areas can control a cooperative subject. A. True. B. False. B. False. The mandibular angle PSA is also known as A. Ear. B. Jaw. C. Nose. D. Sternal notch. A. Ear. The knee stun precedes the joint lock and should create the opportunity to apply a joint lock and establish control. A. True. B. False. A. True. The palm strike straight punch combinations. A. Is designed to stop aggressive forward momentum. B. Is delivered in a stuff arm motion. C. Targets the upper torso, chest, or point of the chin. D. All the above. E, A, and B only. D. All the above. The security guard's legal authority to use restraints is taken from A. Criminal Code. B. Common Law. C. Charter of Rights. D. Section 11 of the SSR and related policy. E, A, B, and D. E, A, B, and D. To keep handcuffs clean, you should A. Clean and disinfect the handcuffs using antibacterial soap. B. Boil the handcuffs in water and air dry. C. Get professionally cleaned. D. All of the above. E, A, and B. E, A, and B. An AST certified security guard can only use handcuffs while on duty and a criminal act has been observed. A. True. B. False. A. True. Upon arresting an individual, the security guard should call the police as soon as possible. A. True. B. False. A. True. The security guard can only let a subject in custody use the washroom if he/she feels they will not be a threat. A. True. B. False. B. False. Which of the following are signs of physical distress? A. Labored breathing. B. Gurgling or gasping noises. C. Unconsciousness. D. All of the above. E. None of the above. D. All of the above. Excited delirium syndrome is also known as A. Acute behavior disorder. B. Delirious mania. C. Agitated delirium. D. Cocaine-induced psychosis. E. All of the above. C. Agitated delirium. A condition in which a subject can abruptly display aberrant behavior and can become extremely agitated and sometimes violent is known as A. Drug overdose. B. Excited delirium syndrome. C. Schizophrenia. D. Positional asphyxia. E. Alcoholism. B. Excited delirium syndrome. Which of the following may calm a subject who is suffering from excited delirium syndrome? A. Shine bright lights in their face. B. Loud music or noise. C. Speak in a calm voice. D. Do not shine bright lights. E, C, and D. E, C, and D. What must you do if a person suffering from excited delirium needs to be restrained? A. Using multiple chain-link handcuffs to secure the subject's hands behind their backs. B. Weight should be removed from the subject's back. C. Place the subject in the semi-seated position or face-up position and call for medical assistance. D. All of the above. E, B, and C. D. All of the above. Positional asphyxia can occur when A. Subject is restrained in the face-down or prone position for longer periods of time. B. Weight is applied to the subject's back. C. Subject experiences increased difficulty breathing. D. All of above. E. None of the above. D. All of above. The end. Good luck!